everyone. So I'm going to get us started here. Well, thank you all for joining us for the Hop on Board webinar series. My name is Emily Dion. I go by she, her pronouns. I am the Assistant Director for Second Year Experience, but my work supports families with their Hopkins students through communication, outreach, programs, and services. So tonight, I want to welcome all Blue Jay families to the Johns Hopkins family. This is the third Hop on Board webinar that we've done so far, and this series is intended to help students and families get acclimated with Hopkins and to answer any questions you might have as you're getting ready to send your student to their new home away from home. All of the webinars in the series are recorded, so tonight we're recording, and it will be posted on the website in a few days. You can find the recording where you found the registration link for tonight's event. In tonight's webinar, we have representatives from Student Health Promotion and Wellbeing, Student Health and Wellness, Student Health Insurance, and Student Disability Services. So they're here to share the extensive health and wellness resources that are available on campus for your students. There is a Q&A feature at the bottom of the webinar, so you're welcome to answer or to put in any questions that you have that might come up during the webinar. We'll do our best to answer questions throughout, and then we'll have time at the end to answer questions. If we're not able to get to your question, just with the timing for the webinar, please reach out to us. We'll put it in the chat as well, but the email is bluejayfamilies@jhu.edu. So that's enough for me. I'll turn it over to our panelists. I'd like to introduce Jennifer Howes. She's our Chief Mental Health Director. Jennifer, the floor is yours.
Thanks so much. Welcome everyone, and welcome to Hopkins. It's so nice to be able to see a good showing here on the webinar and to share information about the student health and wellbeing resources. So as was mentioned, I'm Jennifer Howes. I'm a clinical psychologist. I'm the Chief Mental Health Director for Student Health and Wellbeing. Could we move to the first slide or next slide? Next slide. Great. So I'm here today to share information about mental health services. We offer a wide array of different resources to help support the mental health and well-being of our Hopkins students. And our first point of entry is an initial consultation appointment, and that's really designed to provide rapid access to that initial visit to really understand what someone's needs might be. And then from there, refer to one of the many other resources that we have, both within our mental health services portfolio, as well as to my colleagues that will be sharing with you later on this webinar in health promotion and student disability services, primary care. So we do offer goal-oriented individual therapy. We generally work on a brief term model. We also offer psychiatric evaluation and medication management and a whole array of workshops, drop-in groups, and therapy groups to help support our students. These could be more general support groups, or they could be focused on a particular topic. For example, executive functioning for folks who might be managing ADHD. We also offer occupational therapy. And if folks aren't quite ready yet to start mental health care, but want to dip their toe in the water, we offer a Chat with a Counselor program that provides an easy way for folks to get connected with clinicians on either a topic or particular identity, or just to have that first experience of chatting with a counselor. We also do a whole range of trainings for suicide prevention, general mental health, and mindfulness around campus. And we do support folks if they're needing longer term care or more specialized care with case management support for community referrals. You can go to the next slide. In addition to all the services that we offer on campus, we have a whole host of telehealth services or self-paced electronic services that are designed to help support students kind of wherever they are and at the time that's right for them. So that includes Timely Care, which provides both on-demand support for mental health consultation 24/7, as well as up to 12 scheduled counseling sessions per academic year, as well as psychiatric care as well. Silver Cloud's a great program for folks who prefer something self-guided that they can access at any time on a whole range of topics designed to help support folks' well-being. And you can see some of our other virtual resources here as well. You can go to the next slide. We also offer 24/7 crisis support through our behavioral health crisis support team, known as BHCST. And this is a mobile response team that responds with public safety to folks who might be experiencing a crisis within our campus footprint, as well as 24/7 support through our access line, which is the number you see here on your screen. We strongly encourage folks to put this into their phone just in case they or someone that they know ever needs it. But this will get you connected to our licensed clinicians who work within mental health services at any hour of the day. Go to the next slide. So we have several clinic locations for our students who are just joining us as undergraduates. The Homewood Clinic is the closest one to campus. And this is also the same location as our primary care clinic. We're kind of on opposite sides of the building. We do have the ability to invite students to self-schedule appointments for that initial consultation as well as follow-ups. And if folks are ever, in East Baltimore or DC, they can access those clinics as well. So we have a number of different locations where folks can get care. We do offer our appointments, most of our appointments, either through telehealth or in person. And through our online health portal, we can send and receive secure messages, and folks can access their records and do a whole host of things, sign up for groups and workshops through the secure My Health portal. And finally, we do share a health record with our primary care folks. And so this really helps to support integrated collaborative care across all of our different locations. And as I mentioned, there's a whole range of things that you can do through the health portal. Probably are getting ready, if you haven't already, to upload your vaccine documentation. And so that's the same place that you would go to send or receive a message from your provider, as well as sign up for our groups and workshops and schedule a number of appointments. So that's our health record. And with the next slide, I believe I'm handing it over to my colleague, Dr. Jackie Stone from our Health Promotion Office.
Thanks, Jennifer. Hi, everyone. My name is Jackie Stone. I am the Executive Director for Student Wellbeing, and I oversee our health promotion and well-being offices. And I'm excited to tell you about the work that we do. And I'm going to start by, you've probably heard the word well-being a few times this evening already, to define what that means for us at JHU. So well-being is an optimal and dynamic state that allows people to and communities to achieve their full potential. And I think that's a really great place to focus for a moment. Your students' full potential, right? It's not their roommate's full potential. It's not their lab mate's full potential. And so really helping them as we create this amazing culture, just reminding them around comparison. Maybe you've heard comparison is the thief of joy. Just reminding our students that their potential in the moments that they're at Hopkins, it doesn't matter what they've done in high school. It's important, right? And to remember their accomplishments, but just as a reminder that their full potential is in the moment that they're in. And Dr. House talked for a moment about mindfulness, and we collaborate on those programs, but their full potential in the moment. And you can see, it's just before we head to the next slide, this model that we have on the screen. And this is our 8 elements of well-being, which encompass so much. But we have 8 elements that we program around. We do workshops and trainings and all sorts of things. So you can find all of this, and we'll say it a bunch of times, at wellbeing.jhu.edu. This is where we house, this is the place where you can get to, all of our resources, offices, and the great things that touch upon well-being, not just for the resources you'll hear tonight, but probably a whole source of offices that you'll hear through this series that Student Transitions and Family Programs does. So we can go to the next slide. So health promotion and well-being, my office. Well-being is a critical part of academic and interpersonal success, right? It's not just breathing. It's not just thinking about sleep as something we do when we're tired. It's something that truly supports students being successful in the classroom and outside the classroom, drinking that extra glass of water. It's how we move our bodies and feel joy really does support what students do in their academic spaces and how they connect with folks, with themselves in all spaces. So what we do are programs, events, and workshops to help folks build knowledge, skills, and strategies for today, for tomorrow, and the future. So we have opportunities for involvement. We have a peer health educator group called PEEPS, and they put on programs for their peers. We have probably our most underutilized for undergraduate students, a coaching program, which is just absolutely incredible. Students can work with a coach, and all these programs are no additional charge. They can work with a coach to achieve their goals around health and well-being topics like time management, like creating a sleep schedule for themselves as they transition to campus. I could go on and on about that. Those meditation and mindfulness workshops that are geared specifically for emerging adulthood for college students. Interactive programs around sexual health, around spending money on food as they think about how they're feeding themselves for the first time. All new students will go through a consent and bystander education workshop during their first year. So those are just an example of workshops that we provide for students. Some additional services that we provide, alcohol and drug education sessions. We provide confidential sexual assault resources for students. And again, I mentioned that well-being coaching and consultation services that cover a wide variety of really self-directed services for students. Next slide. So just some places that you can find resources, again, that wellbeing.jhu.edu. You can find health promotion on that site, but you can find all the folks that you've heard from today, but also you're going to hear from today. And we also have an amazing blog on that website, blogs that are written by students, by staff, by faculty, and it's also where we archive all of the university well-being communications that touch upon well-being. So if you are curious about how we handled COVID, for example, you could go back and search for that on our website and find out that information, vaccine information, stress and depression. You can search for that on our site and you can see that through the blog. There's another email here, wellbeing@jhu.edu. If you missed something tonight, you can email that as well. The email that was mentioned earlier is a great place to go, but you can also, if you have a very specific well-being question that is managed 5 days a week, we'll get to it on Monday if you email on the weekends, and we can answer specific questions and we'll get it to the right person within student health and well-being. And of course, we have a really great Instagram as well that students are super engaged in there too. A few tips that I would encourage families to think about with your student is start engaging with your student now about their habits and routines. Start talking to them about their sleep, their eating, maybe there are things that they haven't thought about yet. What about those social connections? There's a lot of research around belonging and loneliness. Those phones are great for staying in touch with your student, but that social media hasn't done a lot of great things for our mental well-being. And so maybe just start talking about habits, like how much time do you want to spend on your phone versus spending time with people? What kind of exercise routine do you want to have when you get to school? How many times a week do you want to work out? But really empowering them to think about it and maybe make a plan. Do you want to put that in your phone and schedule it? What's your stress management strategy going to look like when things get challenging? Do you maybe want to work with someone on that? And then I put a link in here for collegeparentsmatter.org. This is a website out of the state of Maryland. We're part of a really amazing organization called the Maryland Collaborative that addresses high-risk alcohol use, and it's really expanded to cannabis use and other things that touch upon substance use. And we have leading experts both here at Hopkins and throughout the state. And this website is really incredible. And so just really want to encourage you to check it out. And it gives really great tips for talking to your student about substance use and other things that touch upon substance use. So the last thing I'll say is normalize talking to your students about using resources and asking for help, because successful students at Hopkins absolutely do use these resources and absolutely do ask for help. So thank you so much. I look forward to answering any questions that you might have. And I'll turn it over to Dr. Roanna Kessler.
Thanks so much, Jackie. I'm Dr. Kessler. I'm the Chief Medical Director for Student Health and Wellbeing. Look at the next slide. And we've already gotten a few questions, so hopefully I'll answer some of those again here, but feel free to drop other questions in the Q&A. So this is our website for Student Health and Wellbeing Primary Care. And this is a picture of our Student Health and Wellness Center on the Homewood campus, which is our largest clinic. We have about 20 exam rooms and lots of nice resources there. But we also have two other locations, one on the East Baltimore campus and one in the Washington, D.C. campus. So if your student finds themselves on either of those campuses and they would prefer to go to one of those clinics because it's more convenient for them, they can schedule appointments at any of the three clinics. We have one phone number, the same phone number as mental health services. So this is also a good number, I would say, for your students to put in their phone, because that's the main number just to access, primary care and mental health services. We're typically open 8:30 to 5. We have in-person and telemedicine appointments available all day. And then we also have an outside vendor, Timely Care, that Dr. Howes mentioned previously. We have it for both mental health services and for medical services. So if your student is in a different state or is, unable to get an appointment with us, or it's like 3 a.m. and they want to talk to a doctor, they can use this telemedicine service. It's available 24/7, 365 days out of the year, all states, and it's free of charge. Next slide, thanks. So some of the services we offer very high quality confidential healthcare to all of our eligible students. There is no fee for a provider visit, regardless of the type of insurance that you have. So I get that question a lot from parents that, okay, I didn't buy the student health insurance. Can my son or daughter still come to your clinic? And the answer is absolutely yes. There's no charge for a provider visit, regardless of your insurance type. The only time your insurance is going to get used is if we do something that sort of crosses the walls of our clinic. So for example, if we send a prescription, if we send a lab, if we order an x-ray, if we send a specialist referral, that's when your insurance is going to kick in, but it's going to be billed by that other third party. It's not going to be billed by us. So just for folks to know. Our staff consists of physicians, nurse practitioners, registered nurses, medical assistants, a dietitian, and lots of great administrative support staff. We take care of anything your primary care doctor at home takes care of. So whether you're sick or you have a chronic illness, we do physical exams, we do, women's health. We can even do things like allergy injections. If your a student brings their allergy serum to us, we can do that. We can do travel consults. We've got lots of immunizations. And then if it's something that sort of goes beyond the expertise of primary care, we're happy to help your student with a referral. And we also have insurance and referral specialists who can help them make that appointment. At Homewood, in addition, we have the ability to draw labs on site, and we send them out to Quest. We do have a small pharmacy essentially on site where we can dispense medications directly to your student at the time of visit. And we also have an over-the-counter medication vending machine in our lobby where your student can get an array of over-the-counter medications that we, as medical providers, have chosen the medications in that machine, and we have kept them all at very low cost. Next. So pre-entrance health requirements. So this is super important. Every incoming student needs to complete this, and it's due July 15th. So if you haven't heard about it or you haven't looked at it yet, please look at it now. So this is the website, the primary care pre-entrance health requirements that will explain everything. But if you still have questions, there's a general email, healthforums@jhu.edu, that you can always ask questions. We really don't need a physical exam. All we need is the vaccine records. So if you can get an official copy of your vaccine records, great. If you don't have that, then you get your doctor to fill out the form and sign, but you don't need to get a physical exam. Oh, and then a lot of times parents will also ask me about whether they can sort of preemptively have their child fill out medical records release. We do not recommend doing that preemptively when your student comes into the health center. If they want to sign a medical records release at that time, we will help them do that. Next slide. Okay, and someone did ask about emergencies. So as with anywhere else, if you have an emergency, you can always call 911 or you can call public safety. During the semester, the academic semester, there's a student-run EMT service that responds to all calls along with public safety and with Baltimore City. So that's a nice additional service we have. If a lot of parents are concerned if their student is having an emergency and is unable to communicate or get in touch with them, we will attempt to reach their emergency contact. So whoever they list as their emergency contact is very important because that's the person we will try to get in touch with if your student is unable to communicate for themselves and they're having a medical emergency. There's a really close emergency room to campus. It's literally like 3 blocks away, Union Memorial. There's also nearby urgent care centers, and of course, there's Johns Hopkins Hospital. When the health centers close, students can always still call our main number. And if they have a medical concern, they'll be connected with our nurse on-call service who can help them decide, do they need to be seen right away, or can they wait till, the next business day to be seen by one of our providers? They also have that option to use the Timely Care telemedicine service as well. Next slide, thanks. These are just a few pre-arrival tips to keep in mind. We recommend if your student is taking medication on a regular basis, they should have a note in their phone that has the names of all their medications and their doses and how many times a day they take them. Because a lot of times people just don't remember that kind of stuff. They'll say, oh, I take the blue pill, and we don't know what the blue pill is. So it's really important for them to write down the name of all their medications, keep it in a note on their phone. And they are welcome to come to us if there's medications that they take on a regular basis for a health condition. We're happy to continue that for them, if it falls within the realm of primary care. Highly recommend have your student go to the dentist before they come to campus because they might not have a lot of time once they're here. Bring backup pairs of eyeglasses, contacts, maybe pack them a little kit of over-the-counter medications and first aid supplies. Thermometer, very important, because when they get sick, and many of them will get sick, especially in the fall, we're going to say, did you have a fever? And they're going to say, I don't know, I don't have a thermometer. So please, if you can, give them a thermometer. Bike helmet, they're all using those scooters that they can pick up off the street. So very important, send them with a helmet, even if they don't have a bike. Make sure they have a picture of their insurance card and their prescription plan card. And it is also helpful to know if your insurance has a very strictly preferred lab. As I mentioned before, we send out labs to Quest. So if your insurance is like, no, we only use LabCorp, you need to tell your student that so they're aware so they can tell our providers. And then if your student does have a chronic health condition that you think they do need specialist care for, highly recommend that you try to locate someone in the Baltimore area now. Some specialties, especially like endocrinology and neurology, can have really long wait times. And so if you want your student to establish care with a specialist in the local area, it's good to start looking into that now. And these are just some of the resources, our website, the pre-entrance health form information, the question email, and the patient portal. And then I will turn it over to my colleague, Jamie Carl, with student insurance and benefits.
Good evening. I'm Jamie Carl. I'm a senior analyst for student benefits here at Johns Hopkins. Next, thank you. So most full-time students are auto-enrolled into medical coverage here at Hopkins. Medical coverage is through Wellfleet, which utilizes the Cigna PPO network for in-network providers. This plan is an international plan and it'll cover them anywhere in the world. Dental and vision coverage are optional plans here that we offer. Dental coverage is through Delta Dental, and vision coverage is through iMed. So the medical plan, as I said, was administered by Wellfleet, which utilizes the Cigna PPO network. We've partnered with Academic Health Plans. That's the one-stop shop platform for all of our benefit needs. You can access the information, including rates, any other type of benefits, at the MyCare 26 platform. To be eligible for the plan, you must be registered for one in-person class at the following schools. So the annual deductible for the plan is $150, and that must be met before the plan begins to pay. The Cigna PPO plan covers in-network providers for a 90-10 ratio or 100% depending on the level of service, meaning that the plan pays 90% and the student will pay 10% after the deductible is met. The Cigna PPO plan also covers out-of-network providers, but at a lower rate. So it's depending on the care or the service that's being rendered. It's 84, 70%, 90% for the the rate of payout. Preventive care is covered at 100% for in-network and 84% for out-of-network. There is a prescription plan with the Wellfleet plan. It's through Express Scripts. There's a $15 copay for generics and $25 copay for brand name. So we partner with Delta Dental, PPO, and Premier Plus for the dental coverage, and iMed for vision insurance. Both are allowance plans, which means there's a lot of money each year for specific services. And I know I get this question all the time, but Delta Dental, it does not cover orthodontics. I know a lot of people are interested in that, but our plan doesn't. It covers, just the normal fillings and normal dental care. Once the allotted amount is utilized and you've exhausted that, the balance must be covered at 100% by the student. So full-time students are auto-enrolled, as I said before, but if you have private insurance, you can opt out of the plan. You must do so each year. So when you do it as a freshman, you would have to do it again during open enrollment as a sophomore and etc. If you have comparable coverage. You must submit a waiver annually on the AHP website. Undergraduate and master level students can enroll or opt in for dental and vision on the AHP website. PhDs are auto-enrolled into dental and vision as well as medical. Your student can access their student benefits link in their SIS portal. That's where you would see their class schedule, their bill, etc. So the important dates to remember: coverage for the academic year begins on 8/15/2025 and ends on 8/14/2026. And it's split into between two terms. The fall term is from August 15th to December 31st. The spring term is from January 1st to August 14th. And the open enrollment period to waive out of coverage or to purchase dental or vision is July 1st to September 15th, 2025. We only have one annual open enrollment period. The open enrollment period for spring would be for only new incoming spring students, and waivers must be submitted by September 15th on the AHP's website. If not, the student has to be enrolled in the plan. All incoming international students will be auto-enrolled into medical insurance. They have an option of enrolling into dental and vision as well. And F1, J1 visa holders, international students cannot waive out of the plan since that's a JHU-sponsored visa. Visiting students will be required to self-enroll based on the dates of their appointment. They need a copy of their appointment letter to upload on the AHP website in order to obtain coverage. You can make changes to your benefits at any time of the year. Students will be able to process, they're called QLE, Qualified Life Events, within 30 days of that event. So if they're on their parents' plan right now and they waive out of coverage, and then you change jobs and you can no longer carry your student on your plan, they can roll into coverage if there is if your student has children, they're coming in from the United States, coming into the US, for more than 3 months, that's a QLE, marriage, birth, any type of loss of coverage. We are here to support you with whatever questions that you have. Please reach out to the Student Benefits team at JHU Student Benefits at jhu.edu. And if we have any questions whatsoever, feel free. We are here. This is our website, the AHP platform. If you can't get into your student SIS portal, then you can go into the AHP platform and use their credentials to sign in to do the waiver as well. I'd like to pass it over to my colleague, Nicole Hoke-Wilson. She's the Senior Director of Disability Services.
Thank you so
Thank you.
much, Jamie.
Thanks.
So let's go ahead and get started with our presentation. So Student Disability Services is commonly referred to as SDS, as you've seen on your screen. So we say S for services because we work with traditional undergraduate as well as graduate students with documented disabilities in our Whiting School of Engineering, our Krieger School of Arts and Sciences, and our Peabody Institute. And the D stands for disability, which is a physical or mental impairment that substantially limits one or more major life activities. And the final S is for services. We provide a variety of services that includes promoting accessible and equitable student experiences by leading, but also collaborating with our campus partners to proactively remove barriers, raising awareness of best practices, and really fostering an appreciation of disability as an area of diversity. So next we'll move on to some differences between high school and university. And so the university provides accommodations to provide equitable learning experiences for all of our students. But just know that the rights of students are different in college from what they were in high school. And so it's important that high school students and parents understand that these differences and plan appropriately for their students' transition to post-secondary education, particularly Johns Hopkins. So students in high school are covered under what we call the Individuals with Disability Education Act, IDEA, which gives all students in primary and secondary levels the right to a free and appropriate education. And so this includes providing students with accommodations, educational services, therapies, and modifications to the curriculum. However, students with disabilities in post-secondary education are covered under the Americans with Disabilities Act, which was amended, and then Section 504, Subpart E of the Rehabilitation Act. And so these regulations give students at the post-secondary level the right to equal access to programs and services. And so colleges and universities are not required to provide special educational services, therapies, or curriculum modifications that would really fundamentally alter the nature of our program. But there are some services that we offer to all students, and that would include our students with disabilities. So who is eligible? We may have skipped a slide. Maybe if you could go back. Okay. So you can go ahead and proceed. So in terms of who is eligible, we work with students and with disabilities in the area of ADHD, autism, hearing, learning disabilities, medical, neurological, physical mobility, psychological, and visual. So disabilities can be apparent or non-apparent. Apparent are those that are visible, such as maybe mobility, visual, and non-apparent mobility disabilities includes a broad range of conditions from mental health diagnoses to chronic illnesses, learning disabilities, and more. So non-apparent disabilities are just as legitimate as apparent ones, often causing significant life challenges and impact on daily functioning despite being unseen. So both types of disabilities can significantly impact daily life, and neither is more valid than the other. So the interactive process, you'll hear my office really talk about that interactive process to describe our work. And it's really just that collaborative dialogue between the student, campus partners such as faculty, transportation, on-campus living, dining staff, and SDS office to determine whether an effective, reasonable accommodation can be made. And so we begin with the framework of, is this a student with a disability who needs an accommodation that is reasonable and necessary for equitable access that will logically remove any unnecessary academic barrier without fundamentally altering any of our campus standards or objectives. And so the process is about ensuring equal access and equal opportunity. So it's not about facilitating a specific accommodation or a specific outcome. And what this looks like will vary by each student. So when we say the word accommodation, accommodation is just a modification or an adjustment to an academic policy or procedure that allows equal access. And then when we think of access, it really just means an equitable opportunity to full participation. So that's really at the heart and soul of the work of Student Disability Services. So we provide accommodations for academics, housing, dining, as well as transportation. Oftentimes, when we think about sending our students off to university, we're solely thinking of kind of in the classroom, but just know that our services cross boundaries to housing, dining, and transportation as well. So our academic accommodations may adjust the method in which academic tasks are accomplished without substantially altering the task itself or the academic rigor that is required. So academic accommodations are there for access. They do not ensure academic success. So in terms of housing, we provide comparable, convenient, and accessible housing to students with disabilities. So housing accommodations can be requested while recognizing that the purpose of on-campus living is not for studying or alleviating all fears, anxiety, stress, or discomfort, or even to provide places for therapy. So in terms of dining, students with severe food sensitivities or severe food allergies may rise to a disability, and the meal plan offered by Hopkins to students may need reasonable modifications, and that would come through my office as well. And then in terms of transportation, we provide accessible transportation for students with disabilities who require assistance traveling within our Homewood campus. So affiliating with SDS is crucial for ensuring that students with disabilities have equal access to education. So to request disability-related accommodations or services, Johns Hopkins students should complete the process as you see outlined on this slide. So first, the student completes our SDS online application, then submits documentation. The student will receive a system-generated email stating that we have received your application. The student will then receive an email from SDS staff informing them of the next step, which is to schedule a meeting with an SDS advisor. So meeting with an SDS advisor really allows for discussion about available accommodations and how we can support the student's access to education. And so this personalized approach is really essential for ensuring that the student's unique needs are addressed effectively. And so once accommodations are confirmed, an eligibility letter will be sent to your student. The student will then be able to access our online portal again to then request their academic letters go to their faculty. And so just remember to remind your student that it is the student's responsibility to log in each semester or term to send their academic accommodation letters to faculty. So that would include our fall semester, our winter intersession, our spring semester, as well as all the terms that we have during the summer. So we look forward to connecting with you via the means you see on the slide. So you can visit us in Schaffer Hall, room 101 on our Homewood campus, or by phone by calling 410-516-4720. You can email Student Disability Services at jhu.edu or visit our website, sds.jhu.edu. And remember to follow us on Instagram at JHU Disability Services HWD. Thank you.
Right. Carly, can we go back to slide 2 just so we can see all our panelists and contact information, please? So we do have some time now. I think there's still a few questions in the chat, but if y'all have any questions, I can give y'all a minute or two to put them in the Q&A so our panelists will answer. But thank you, panelists, for all your information. Okay, so I see a couple coming in now. Oh, great. One for insurance. Is the JHU insurance covered by the Questbridge Scholarship?
I'm not exactly sure. That would be a question for financial aid. I'm not sure how different scholarships are applied to count.
And we can get you financial aids as well. Thank you, Jamie. And then is food allergy considered a disability needing accommodation for dining? Nicole.
I would say have your student connect with Student Disability Services because it does really depend on the severity of the food allergy, which would then lead us to conversations as to what would be the accommodation needed for access. So if your student does have a food allergy, I encourage you to have that student to get affiliated with Student Disability Services so that we can have that conversation.
Just want to plug a quick service that we have in addition to that. There is a dietitian with dining and who does a great job with like orienting students. They'll like give them a tour of the different dining facilities to talk about how ingredients are incorporated in the different dining options and the different spaces. And then we also have a dietitian whose primary role is with primary care. And then she also works 1 day a week with my office to do programming. And so just from a perspective of learning about food and different things. I know this isn't quite what the question was, but just for all students to think about how they integrate diet and acclimating to meal plans, being away from home, whether you're an international student or a domestic student, and like being responsible for feeding yourself maybe for the first time. That's just another service that we provide as well. And so just wanted to put it out there that there are different ways to think about food as well, both for students who have allergies that may need accommodations or for students who are just thinking about food in different ways for the first time.
Thank you so much, Jackie. Appreciate that. We have another question for Nicole. For those who need housing accommodations due to a disability, will the algorithm pre-sort us before our accommodation application is processed? And then how does that process work?
So I would encourage students who will need housing accommodations due to a disability to again become affiliated with SDS. Once you submit your application, your documentation, we can have that initial meeting and really talk through your accommodations so that we can then put housing in place that meets your accommodations. So in terms of, I wouldn't say that there's an algorithm that pre-sorts, but my office, SDS, does work with on-campus living for those students who do submit in their accommodated housing application so that we can review those and look at the housing accommodations that would be needed and place them accordingly.
Thank you, Nicole. Okay. If students have dietary preferences, vegan or vegetarian due to religious beliefs, how are they addressed during housing allocation?
Do you want me to do that? So I'll answer a little bit, but my office handles those that are really based on disability. But we do have an Office of Institutional Equity that does work with students with religious accommodations. So I would encourage students to get in touch with the Office of Institutional Equity to really discuss accommodations that are needed due to religious beliefs.
Great. Thank you, Nicole. And then I think I have another one for you here. Should I still request accommodations if I'm not sure I'll need them, i.e. extensions on academic assignments for possible chronic illness flare-up?
And I would say that the decision lies with the student. I would encourage you, and just on my history of working in the field, I would encourage you to affiliate with our office sooner rather than later. Because that way you already have your online application completed, you've already submitted your documentation, and you've already had that initial meeting, and you can see all the accommodations that you're eligible to receive. You can then put them in place when you would like to. So you could request your letters at any time during the semester. And you gave kind of specific examples due to a possible chronic illness flare-up. Those things are never really predictable. And so that's why I say affiliate with our office sooner rather than later, because accommodations are not retroactive. They only go into place once that faculty member has received that accommodation letter. So if maybe you wait until mid-semester, it's not going to go back and take care of anything that happened from the first day of class. So again, they are not retroactive. So I just encourage you to affiliate with our office sooner rather than later. Our office is open whenever the university is open. So get in touch with you. We love to have these types of conversations with our students.
I was answer one of the questions about therapy sessions and coaching, and maybe I'll let Jackie answer the coaching piece. But at Mental Health Services, we do operate using a goal-oriented model. So while we don't have specific session limits for our therapy sessions, we do work with students around identifying a particular goal that we work with them on and helping to support them in meeting that goal. We also offer solution sessions, which are single session consultations designed to help folks make, progress on a particular issue or concern that they may have, and they're welcome to schedule as many of those as they wish. And then we also do group therapy as well as workshops and groups that are really designed to help build connectedness and learn new skills and experience support in a group setting, which can be really, really helpful for a number of, skill-oriented things like executive functioning. We do virtual and in-person body doubling for folks who might need a little extra help with task initiation and completion, in addition to a whole range of others that are on our website. If somebody has been in ongoing therapy, I think there's a question about that coming up in the chat, and really likes to have that sort of weekly contact with a provider, that's probably a better fit for getting connected with a provider in the community. And we have a whole range of options nearby campus, and our case management folks would be happy to help people get connected if they know coming in and that's really what they want, is ongoing, regular care. And so once folks get to campus, the best way to initiate services with us is to schedule an initial consultation. And that's that first meeting where we can take a look at what the student's needs are and then make the determination about which service is going to be best fit for them and their needs. If you have someone who has more specialized needs or requires has more complex concerns, it can be helpful to contact us ahead of time to just better understand the options, and we can consult about your specific situation to help connect with specialty care if needed. Some folks need kind of more intensive care or might be, coming in with needs that would be a better fit for a specialist in the community. So you're welcome to give us a call and we'd be happy to think through that with you. And then I'll hand it over to Jackie for the coaching piece.
Yeah, similar to what I said earlier, like the coaching is really goal directed. We don't have session limits either, and we've not ever had a wait list for coaching at this point. And so it's really the idea that students come in and say, gosh, I really want to work on my sleep. I'm just noticing I'm having a hard time transitioning. Time management is probably our number one thing. They don't necessarily come in and say it's time management, but we kind of figure out through some question and answer, and set a couple goals each week and check in with folks. And it's really self-directed by the student. Folks come to us because they notice something's going on, or we're partnering with the folks who are on this call, an academic advisor, they get to us through some type of pathway. And we're just working on those goals, maybe a 30-minute check-in session. And all the folks who are doing that coaching have gone through some type of structured licensed program to get that. So we're not just making it up as we go. And it's really an evidence-based practice to help people achieve the goal and be the best student, person, partner that they want to be in support of their academic and interpersonal goals. So again, sleep, kind of work life, school life balance, a number of things. We have I can put it in the answer in a moment, but on the Wellbeing website under health promotion services, coaching. And so it's kind of what is coaching and what isn't coaching, and folks can sign up kind of directly through there. We are not in the health portal yet, but we will be soon.
Thank you, Jackie. Yeah, and if you could answer just on the website, I know there's a couple questions there directly, but great. Seeing questions kind of slowing down here. Does anyone have any final before we start wrapping up for tonight? Okay. Well, if there's no other questions, I just want to thank you all for joining us. Thank you to the attendees who are here, to our Blue Jay families who came tonight, and then thank you so much to our panelists for graciously offering up your time tonight and giving more information to our Blue Jay families. Like I said before, a copy of this recording will be available in a few days' time on our website. It's in the same place where you found the registration for tonight's event. Quick note before y'all leave, your student will begin the new student orientation program at 6:30 p.m. on August 17th, and that will go on until Monday, August 25th when classes start. Just a heads up there that your student will most likely not be able to physically reconnect at any point with orientation just because there's a lot of events, program, and information going their way. So we just ask that families don't plan to stay in Baltimore once you do the drop off on the 17th, 18th. If you have any questions about that, please reach out to us. Like I said, bluejayfamilies@jhu.edu, and we can answer any concerns there. And then just a heads up that our next Hop on Board family webinar will take place July 10th at 7 p.m. Registration's available on our website. And yeah, that's all. Thank you all so much for being here.